My name is Richard Wormold. I'm an ophthalmologist and I'm a consultant at Moorfields Eye Hospital, where I've been since 1994. Mr. Radford. The certification of vision impairment is making an official statement about a patient's level of vision. It's an extremely important process for patients who are having difficulty with their vision, because it opens the door to a wide range of services and support. But most importantly, really, they're about letting the local social services know that you have a problem with your sight, and then you be contacted and offered a range of options. The services and benefits that are available depend to some extent on whether you're certified as vision impaired or severe vision impaired. We don't register you here. We fill in a form, which is a certificate, to say you're entitled to be registered with a local.
My name's Nick Radford. I have retinitis pigmentosa. It's a genetic disorder, and over the past 6 months or so I've noticed quite a bit of deterioration. The main thing that getting certified helped me to realise was just exactly what's on offer. As I've had this condition for a long time, I feel like I cope very well, but that doesn't mean that there aren't other ways of doing something or things out there that can help.
So if you're willing to go ahead, shall we consider filling in the form now?
Yeah, definitely.
If that sounds okay. Ophthalmologists vary in their attitudes towards the process of offering certification, and it's to some an admission of defeat. You know, your treatment has not been effective in preventing someone losing their eyesight or preventing their eyesight deteriorating. To others, it's only something that you do when there's nothing else that can be done or offered. And sometimes patients and surgeons together get into a kind of collusive relationship where they're trying to avoid actually getting and admitting the fact that the vision's got to a point where they're entitled to all this additional support.
When I was first informed that I could be certified as visually impaired, I was in my mid-teens. My initial reaction was very negative. It was that psychological barrier of thinking, that's me admitting defeat.
And I think in this case, because the sight has got so poor, you're entitled to be certified as severely vision impaired. That doesn't mean you're completely blind, far from it, but according to the criteria, your sight is poor enough to entitle you to the maximum level of benefits. The best way to introduce the idea of certification of sight loss to a patient is to emphasise that it is not the end of the road. It doesn't mean we can't do anything else to help. In fact, it means there's a lot more that we can do to help, and this is the process that enables it. It certainly helps if you've mentioned it before, so it doesn't suddenly come out of the blue. And very important now, as we've learnt over the last few years, the availability of an eye clinic liaison officer who can pick up that patient after you've had that conversation and follow through with support.
The best thing for me going through this process and getting myself certified and registered is it feels like I'm, rather than admitting defeat, it feels like I'm, planning ahead and being proactive and, in a way, not letting my condition get the better of me. It's opened up these much easier, much healthier opportunities and pathways to deal with different things, so that in the future I know that there's support and that I can cope.
Yeah, sometimes a patient will ask about certification, and I must say I'm rather impressed when that happens. It's my view that patients need to be empowered. They need more information about what is available and what they're entitled to, and I think we should have information in our clinics about sight loss certification and encourage people to ask about it if they're having any difficulty. It limits your ability to do certain tasks, presumably. Another barrier for colleagues to actually get on and offer certification to patients is the perception that it's a tiresome bureaucratic task. Well, that's not true. But one thing that's clearly needs to happen, and we've been trying to make happen for a while, and will certainly happen soon, is we'll do this as an electronic online process where it can be done quickly on a computer screen with the patient present, so you can fill the form up together, you press the button and it sends it straight to social services in an instant. For more information about the Certificate of Vision Impairment, visit rcopthth.ac.uk/CVI. This film was made by RNIB, supported by the Royal College of Ophthalmologists, Vision 2020 UK and the UK Vision Strategy.